Alright, hi Taylor, I'm Simon, I'll be your intern. So I'm going to assess the oracles for position, size, symmetry, nodules, or skin lesions. So those look alright, and that left one looks good as well. Just checking for tophi or basal cell carcinoma. And I'm going to assess the external ear canal for discharge or swelling, arrhythmia. That's normal as well. And the other one is good. And now I'm going to check the ear canal with the otoscope. And I'm just going to, so first I'm going to turn the otoscope on. And I'm going to take the ear, first put the otoscope in the ear. And then I'm going to pull the ear backwards. And check and make sure the and just checking to make sure the tympanic membrane is gray and slightly see-through as well, and the very light cone should go along the ramus of the jaw, and it was, so both of his ears were good. Then I'm going to, I guess the eardrum was the layman's term. So I'm going to move the tragus. And is there any pain with that?
Nope.
Any pain with that? And then I'm going to pull on the auricle. Is there any pain with that?
Nope.
Any pain with that?
Nope.
Nope. Just checking for otitis externa. And then I'm going to palpate both of his mastoids. Checking for tenderness and any discomfort of the otitis media. Is there any pain with any of that?
Nada.
And that could be indicative, if there was any discomfort or swelling, it could be indicative of mastoiditis. So now I'm going to check for auditory acuity. So I'm going to close this ear with that hand, and I'm going to pluck the tuning fork. Oh, excuse me, I'm going to I'm going to do like the wrestling fingers test, basically, is for auditory acuity. So just raise your right hand when you can hear this. Alright, and I'll cover this ear. And tell me when you can hear this. Alright, so both of those are good. And then Weber test, I'm going to use the tuning fork, the 512 hertz, and I'm going to place it on top of the patient's head, and I'm going to ask if basically in both ears it is heard evenly. Is it even in both ears, or is it distributed differently? Alright, and then Ryan's test, it's going to be comparing bone and air conduction, and I'm going to take the 512 hertz tuning fork again, and I'm going to place it on the mastoid process, and I'm going to ask the patient to tell me when they can no longer hear the sound, and then I'm going to turn around and place it in front of their external auditory meatus and ask that it basically should take twice as long for the sound to disappear in the external auditory meatus as the mastoid.
No longer hearing
Can you still hear it?
Yep.
Alright, yeah, that's good.
Can't hear you. Yep.
Alright, that's good as well. So yeah, there shouldn't be any, there was no problems with bone or air conduction. And then the Schwabach's tests, we don't really use it anymore, but we'll be on boards. So basically, I just hold it outside of his ear and ask him if he can hear it. Can you hear that?
No.
And if I can still hear it, then has a problem, which makes no sense because my ears could be incorrectly
Can't hear you.
hearing as well. And I still can, so yeah. It's a poor test, but that should wrap up the ear test, so.